Hello and welcome to tonight's free webinar on celiac disease. My name is Martin Stone from Switch On Health, and tonight is the third and last free session that we are running this week in conjunction with Natural Medicine Week 2021, which is hosted by the Australian Traditional Medicine Society. Now, before we start, I just want to say a big thank you to everybody for coming along tonight. We do these sessions for free, so we really appreciate it when you turn up and participate. So thank you so much for coming. Now, if you happen to be watching the recorded version on YouTube, please help us just by clicking that button that says like, and also click the button that says subscribe, because the more subscribers we have, the more we can offer. And we look forward to offering you more. Now, tonight's topic is on celiac disease. Now, if you're watching this and you don't actually have celiac disease yourself, there is a good chance that somebody you know or somebody close to you will actually have celiac disease. And the funny thing is, they might not even know it yet, because a lot of people are now being diagnosed with celiac disease later in life. Not everybody has the symptoms that you would expect. Now, when you are diagnosed with celiac disease, it does make a huge difference to how you have to think about what you eat, and also just for your health in general. But luckily, of course, there is a ton of things that natural medicine or complementary medicine can do to help with management of this condition. And to take you through some of those this evening, we've got our expert naturopath and homeopath, Sally Maisie. Over to you, Sally.
Hi there. Thanks, Martin. I'm just going to turn my camera off, guys, just because of the fact that I'm sitting on top of the Great Dividing Range and the signal's not so great, especially on this Sagittarian full moon. So I'm going to go through and just speak rather than be visual. Okay, I hope you enjoy it. So let's continue. All right. So we're going to talk about celiac disease tonight. And as you can see, there's a big sign there that says it needs to be gluten-free. And obviously with it being gluten-free, then that to me would consider that gluten is one of the causes of this particular disease. So what is celiac disease? It's two things. It affects many body systems, but primarily the two main issues are going to be digestive, and the second one is going to be autoimmune. Now, what happens is gluten, which is a protein that's found in a whole heap of grains, and you can see there that I've put wheat and barley and rye and oats, and I'll talk a little bit about oats in more detail, but I've also put some other words in brackets with those grains, and one of them is gluten.
Sally, we've just lost your sound. Hi, Sally, I hope you can hear us or hear me. We can't hear you, unfortunately. Hopefully we're not going to have a repeat.
What they are is that okay, I'm back on board there. I don't know how much you guys got, but I will continue and persevere. Just bear with me a minute. So I hope you can all see. Can you see the slides, Martin? Can you see the slides?
No, they haven't come up.
Okay, all right, I'll have to bring them up. No. Okay, let's continue. I'll keep continuing. It gets better as the night goes on for some reason. So yeah, if you didn't hear all of that, basically gluten is basically a sort of binding agent within the grains, so that it makes baking easier. It works like a glue, okay? And so therefore, the reason why we use these grains is because it makes baking easier. another thing that is an aspect of celiacs is a thing called Zolin. And Zolin is also a protein, but it affects the gut. So this is what inflames the gut as well. And these proteins as well. And in particular, I hope we're still connected.
Having a few issues with the sound, Sally. Apologies, everybody. We tried everything we could think of, including forcing Sally to sit outside.
You there, Martin?
Yes, Al, you're back on. Thank you.
Hello, can anybody hear me, Martin?
Yep, you're back on, Sally. We can hear you now.
Continue on. I'll continue on. Martin, can you still hear me?
Yep, you're good to go, Sally. Thank you.
Beautiful. Thank you. So you can see basically what it is a whole heap of proteins get together, work as a binding glue, and then cause digestive inflammation. Now, the digestive inflammation is because of it being an autoimmune disease. Now, what that means is that the bread that you eat or the grains that you consume are seen as foreign in the body. So the body decides to have an immune response and tries to rid the body of the bread or the pasta or whatever it is that is gluten-based from the body. So it causes inflammation along the way. And then thus what happens is in the small intestine, you have all these lovely little finger-like projections called villi, and they start to become destroyed. And destroyed to the point where, and you'll see a picture in a minute, where in a normal small intestine, they're upright and sort of they pick up all the nutrients and then take them and absorb them into the bloodstream. When you have celiacs, those villi are flattened and you cannot then absorb your nutrients. So what happens is malabsorption and malnutrition. And some of the major minerals that are missing are your calcium, your iron, your zinc, the fat-soluble vitamins, so your A, E, D, and K, some of your B vitamins, so B12, B6 as well, and folate. All of those are then malnutrition. So malnutrition then leads to nutrient deficiencies, and these nutrient deficiencies then lead to certain diseases, and we'll discuss that a little further. According to the Medical Journal of Australia in 2017, approximately 1 in 86 men and 1 in 56 women. So more women are affected than men. They don't know why, but it just seems to be the case. So here you can see a normal gut, normal small bowel and large bowel. You got me, Martin?
Yep, got you. Thank you, Sally.
Excellent. Thanks, Martin. You can see here, so sorry, I do apologise for all of this interruption, guys. I really do. You can see here that this is from Bupa, and it shows you normal digestion. So the large intestine, the small intestine, it's taken a piece of the small intestine and showing you normal villi, which are those finger-like projections that basically pick up the broken down food. So the nutrients that are then chemically changed, absorb that into your bloodstream. But then you can see a celiac's villi, and they're flattened. So they cannot then absorb through the mucosal lining and the lumen of the gut. They cannot absorb any nutrients. So this obviously becomes an issue. So what causes celiac? The first thing is genetics, and they've worked out that the antigens are, that the genes actually are the HLDQ2 and DQ8, which means that anybody with a family history of celiacs is more likely to get celiacs. Now, the problem with that is, as Martin mentioned, is that it can be asymptomatic. So you may not know that you've got it until you're quite older. And obviously with your gut, if your gut's unstable and your bowels are not well, you just begin to think that that's the new norm. So you may not actually start to get tested unless there is that family history. And I certainly implore anybody who's got a family history to go to the doctor and get tested. And especially if you're going to have babies, you know, little ones, to get them worked out from the very beginning is very good. Come about through other autoimmune conditions, such as your type 1 You've got rheumatoid arthritis, thyroid issues, so both Hashimoto's, which is, you know, environmentally and internally, you can get these immune responses. So from a by looks like we've dropped out again, Martin. Okay, so as I was saying, they don't know why these environmental factors can trigger an event which then becomes celiacs, but they can say that trauma and stress, post-surgery, post-childbirth, you know, obviously when you have a child or when you have surgery or you're stressed or traumatized or you've had lots and lots of rotaviruses in your childhood, they say that you can have a triggering situation, which means that there's then immune response to when you were eating gluten to now you are eating gluten, and you have this sort of trauma happen, you have this inflammation occur, and the body all of a sudden starts to recognize gluten as being foreign. So it then tries to attack it. And that's when your celiac is potentially discovered because of some of these environmental factors. It says there that breastfeeding is vital. Yes, it is. Breastfeeding can help because if mum does not have celiacs, then therefore, and I think I'm crackling again, Martin, I hope you can still hear me. If mum doesn't have celiacs, at least she's feeding some of that gluten into her bubba by breastfeeding. Yeah. From that sort of perspective, it's now a new advanced treatment, which I'll talk about in the end, but it's about nanoparticles, and we'll discuss that a little further on. You can see here your risk factors, genetic predisposition. So, you know, when I say first degree family, it's mother, father, siblings, okay, syndrome, so that's your Down syndrome, you might have been diagnosed with other autoimmune, and sometimes leaky gut or IBS or a predisposition for gastrointestinal complications where you've already got inflammation there. You can do genetic testing, but it's not the gold standard of testing. We'll talk about what that means in a minute. Down syndrome, you can see the type 1 diabetes, thyroid, etc. Now, Crohn's disease, ulcerative colitis, IBD, IBS, cancers, all of those can actually trigger, because what those are inflammatory gut disorders as well. okay? When you think about digestion, you need to consider that digestion in itself, with the whole process of eating, chewing, breaking down food, absorbing food, that in itself is actually an inflammatory process, because the gut, by moving, is heating. So it's becoming inflamed. Yeah. Now that's normal, but if it's aggravated and it's constant, then it's not so normal. Okay. So you can see here some of the signs and symptoms. Now, orally, there's mouth ulcers. Your teeth can begin to erode. You can get angulostomitis, which is the corners of your mouth, and I'm not on camera, but you've been seeing me pointing to the corners of my mouth where they start to crack. And I'm sure you've all seen little people, young children, when they've got cracked corners of their mouths. That's a nutrient deficiency and it needs to be addressed. It's not just because they've got dry lips. It is actually a nutrient issue. Excuse me. Abdominal pain, obviously, because it's to do with the gut. Cramping. Now, whenever I hear that word cramping, the very first thing that I think that might be lacking is magnesium. Just to let you know, that word cramp is a key word to magnesium. Distension. So that means that there's pain, and when you press on the gut, it might feel hard, it might feel sore. There's bloating, which means that there's fermentation going on. In some cases, there can be nausea and vomiting. In other cases, there can be flatulence. They can have loose stools. This is why it's really vital that you all download the Bristol stool chart and have that available for your clients to look at. It's how we're naturopaths, we're nutritionists. We talk poo all the time. So, you need to get used to talking about bowel movements, yeah? Stratoria is known as, it's basically when you look into your toilet bowl, there will be this oily sort of floating slick of bowels, of stools, and it just doesn't look pleasant. It smells awful and doesn't look pleasant. The color of your stools also indicates whether you're well, and in this case, for some celiacs, they have quite pale stools. You can see there that they alternate between constipation and diarrhea. Now, that's because they've got leaky gut or they've got IBS. They've got this inflammation, and it's really quite horrible for them, But they've had it for so long in some incidences, because they've eaten bread nearly all their life or pasta all their life, that they know no different, because to them, that's normal, yeah? Other indicators could be acne. A really clear indicator, and we normally find this indication because there's something going on with the liver, is skin rashes. In this case, it's called dermatitis herpetiformis, and what that is this really severe rash that they might get on their arms, and it's extraordinarily itchy and extraordinarily painful. They itch to the point where they bleed. Now, that's not going to help when they've got brittle nails either. So they're itching to where they bleed, and then their nails are cracking at the same time. And at that same time, they're losing their hair. So they're in all sorts of dilemma, yeah? And imagine that's a little person or a teenager or a young adult, where they're just trying to get out there and be accepted by society, and all these things are going on. Weight loss can become an issue. For infants in particular, they fail to thrive. You might actually see that they get a little puffed belly, which, they could be then moving on to sort of a marasmus, which is this, they're not absorbing their proteins properly either, even though they might be eating good proteins. And they might be really irritable little people. Mentally, emotionally, you're looking at fatigue, you're looking at low energy with that lethargy, and brain fog. Now, brain fog is not only lack of concentration, but it is also short-term memory issues. So that brain fog is, when you're staring at a page and you've read the same sentence 6 times, that's a little bit of brain fog. Or, you're having constant sort of short-term memory loss, or you're having lack of concentration. Imagine that in a little person when they're at school, even, how difficult that could be for them. Here's a picture of what we're looking at here. So obviously the bowels are affected, the gut is affected. Overall, they're going to not look well. They're going to have sort of, puffed bellies. It says there ecchymosis. Now that is a type of bruising where they get like little pinprick bruises all over their body. In particular, they might get it in their mouth. But ecchymosis is types of bruising, and the reason for that is because they're not getting enough vitamin K. There's muscle wasting, again, that's because of your magnesium, your calcium. There's neuropathy, which is a form of sort of pins and needles they might find peripherally in their hands, their feet, their legs, that they get, tingling on pins and needles. All right. How is it diagnosed? As you can see there, it's often misdiagnosed as IBS or lactose intolerance or just a wheat intolerance or a sensitivity. It's rather than it being actual celiacs, which is really quite nasty. And they might often get a negative result depending on how many times they've had their tests run. But the main thing that they now do is the pathology blood tests, the serologies. The main one in particular is your TTG, which is trans-glutamase. You can see there's glutamate there. There's an A's in there, which means that it's a protein, and there's antibodies. So in particular, they're looking at when you see, and so that's TTG, but when you see IgA or IgG, they're known as immunoglobulins. And immunoglobulins, in this case, the A and the G, are those that cause an immune response, okay? Now you've got an anti-TTG, which is basically looking at the antibodies and looking at the antigens that are involved, and then you've got your specific antibodies like your gliadin. They're also going to test for autoantibodies, which are that specifically target healthy tissue. Now, the main thing that's really important when you're having these blood tests, because, everybody thinks, oh, no, I'm going to be tested for celiac, so they immediately stopped eating gluten and gluten products, is that you have to continue to eat gluten. Because what happens with these tests is that they are showing raised levels of this IgA and IgG, okay, or raised levels of gliadin in the blood. So that won't show up if you're not eating gluten. So you've got to make sure that you explain to your clients and your patients to continue to eat gluten until they get a clear confirmation and a clear diagnosis of celiacs. Now you can see there that I've put what's called gold standard. The gold standard, it is still the gold standard, which is unfortunate because it's quite invasive, is that you end up having an endoscopy where they take a biopsy of a piece of your small intestine. Now it's a day procedure and it is quite invasive and it can be a little bit scary. Imagine you're a little person that's having that, a child or even a teenager or a young adult. You can start to feel a little bit nervous and a little bit apprehensive. Some of the other tests that they might run purely because of the fact that they need to confirm that there's nutrient deficiencies going on as well is a full blood count to look for your red cells and your white blood cells. They're going to look at the inflammatory markers, which are your ESR, so your erythrosediment rates and your creatinine protein rates. They're going to do electrolyte and liver function tests. They're going to look at your vitamin D, your E, your B12, your folate. They're going to do iron studies and they're going to do stool tests. Stool tests, though, aren't a good marker anymore. They're not a good gold standard, but they might run them just to see whether there's any sort of, parasites or nasties within the stool anyway, or any bloods and things, because obviously with inflammation, there could be some internal bleeding as well, depending on how dire and how severe and chronic the celiac disease is. So you can see here, persistent recurrent symptoms. They run tests, they do biopsies, depending on whether it's negative and positive, depends on which way they're going to go. If they see that there's a flattening of the villi, which is villus atrophy, then they're going to send you off for more tests potentially. But they're going to send you to a dietitian no matter what. They're also going to consider all sorts of intolerances. You can see there that it says lactose intolerance. Well, obviously that's your dairy. Fructose intolerance. Now they're going to look at FODMAP. Now your FODMAP is all the different types of sugars, and you may need to put your patient onto a FODMAP diet or an anti-inflammatory diet for a short period of time to try and get rid of the inflammation and heal the gut. You can see there that there could be a bacteria overgrowth. Now that's not the good gut bacteria. So obviously, probiotics, prebiotics are going to be necessary. So we need to get that microbiome balance back. There could be pancreatic insufficiency. So that means that, you're not releasing your insulin, you're not getting the glucose into the cells. IBS, so irritable bowel, leaky gut. You can see that other little slide though. This is when you need to go to a specialist because the celiac's disease has gone too far and the gut can't be healed. As practitioners, we hope to get to our patients as quickly as we can to get a diagnostics for them. And we need to send them to doctors to do that because obviously we can't do it. But if it's gone for too long and is too chronic, they may actually have to have immunohistochemistry, which means that they may have to have, intravenous sort of treatment. So it's hospitalization, which is really quite daunting. If untreated. So if it goes untreated, it becomes a very severe systemic issue because it affects several body systems, and we're going to go through some of those body systems. So you've obviously got your central nervous system. We've talked about that paresthesia, which is your tingling, your numbness, your peripheral feet and fingers and hands would tingle. There's certainly going to be anxiety and depression because they may not be absorbing their proteins as well. So their neurotransmitters, the amino acids, are not getting to all those feel-good neurotransmitters. They could suffer from vertigo or dizziness or have migraines. In some incidences, they may experience epilepsy, so they may have seizures. And for some patients, they can end up, because of the fact that they're so unwell, they can end up on this vicious circle of chronic fatigue. And then we have to sort of do all sorts of treatment protocols for them. Musculoskeletally, they may experience arthritis, so swelling of the joints, and it's going to be quite painful for them. And they might experience some edema surface-wise on their hands. There could be muscle wasting, and there could be osteoporosis. And again, this is all due to nutrient deficiencies because of malabsorption and a malnutrition, okay? Osteoporosis, primarily vitamin D, calcium, magnesium. Whenever you think calcium, you have to think magnesium because they run in a synergistic ratio together. So you have to remember that. Circulatory-wise, as we've talked about, ecchymosis is that bruising, small bruises, not large bruises. There might even be some pétaché, which is tiny little bleeds, little red dots. And as I mentioned before, there can be internal bleeding as well. And that becomes quite nasty because they're going to start seeing potentially black stools because it's in the small intestine. So whenever you start to see black stools, you need to have some concern for your patient. And it may be because of what they're eating, but it may be because there's internal bleeding. Immune-wise, obviously, it becomes autoimmune, so the body starts attacking itself, but they have bad wound healing. Now, all wounds should heal. Most wounds, if you cut yourself, should heal within 7 days to 10 days. If they're in your mouth, they should heal within 24 hours to 48 hours. If wounds go longer than that, then I would be looking at their immune system. All right. So wound healing becomes an issue. You can see there, we've talked about lactose intolerance and other digestive disorders. We've talked about iron deficient anemia, but it could also be B12. So there are many types of anemias. Don't just get into the habit of thinking that anemia is only because of iron deficiency. It could be because of you're not producing enough intrinsic factor, and B12 has to do with that. So you need to look at the different types of anemias that could be occurring. And obviously vitamin D deficiency. Now, when we look at vitamin D deficiency, we could be looking at osteopenia, we could be looking at rickets in children, so, you know, bone disorders, okay? Reproductive wise, mainly in women, they're going to have menstrual issues, so amenorrhea, meaning absence of period. They could be in infertility issues, there could be miscarriages. You may find that the patient comes to you predominantly because they're miscarrying. So it's really important that we can determine, well, is this miscarriage, as practitioners, we need to determine, is this miscarriage because of structural and functional issues, or is this miscarriage because of the fact that there's hormonal imbalances due to nutrient deficiencies? So it's really important that we look further than just what we see. Yeah, again, we're detectives. We need to detect what's going on. And early menopause. Some women can go into early menopause when they've got celiac. So you can imagine, you know, if they're going into early menopause, when menopause is, you know, mid to late 40s, early 50s, you know, if these women are going into menopause in their early 40s or even their late 30s, early 40s to mid 40s, I'd be not only looking obviously at the hormonal imbalances that could be going on, but again, it could be their gut. So never rule out the digestive system as a precursor to reproductive issues. You can see there that there's delayed puberty. So it means that their menarche, which is their very first period, could be delayed. They may not develop breasts as quickly. They may not have pubic hair or hair under their arms as much. So there could be delayed puberty symptoms that are seen. There could be stunted growth because obviously they're not getting all the vitamins and minerals necessary for growth. And you may find that there are birth defects in mothers that during labor they are not getting the right nutrients, in particular folate, which we just spoke about. They're not getting that folate because they haven't been yet diagnosed with celiac disease. Precursors as well, you've got your colon, your breast and your uterine. So you can see there that it seems to affect women more so than men, and you saw that when we talked about the statistics. You can see here, again, with this slide, we've talked about diarrhea, we've talked about distension, vomiting, we've talked about failure to thrive. So they're your gastrointestinal manifestations. Neurologically, we've talked about epilepsy and tingling and numbness. We've talked about inflammatory myopathies, so that's your inflamed muscles. We've talked about encephalopathy, I'll try that with my teeth in, literally meaning that there's something going on in the brain where it becomes inflamed. Schizophrenia. Orally, there's enamel issues, Sjögren's syndrome. Now that's another autoimmune which affects all aspects of the multisystemic. You can certainly Google that later and research that later. These children, because of that stunted growth, may have quite enlarged foreheads as well. And that can be quite, you know, daunting to some little people. Vitiligo, so you've got that discoloration of skin. So in African Americans, you might find that they have patches of white. in their skin, psoriasis, which we all know about, alopecia, which is where they're losing their hair. You can see megaloblastic, you can see these different types of anemias as well. And, you know, tendency to bleed, thrombosis, which is clotting. You've got the liver being affected. So you've got neurological, you've got oral, you've got facial, you've got dermatological, so it's skin. You've got hematological, which is your blood disorders. You've got your hepatic disorders, which is then your liver disorders, all right? So you can see there that there could be a fatty liver, there could be hepatitis. You know, we're not talking about hepatitis A, B, and C, the infective sort of bacterial ones. We're talking about autoimmune hepatitis or biliary cirrhosis, which is, you know, the fact that the liver is not functioning properly. And this is where you start to see those skin rashes, yeah? Because when the liver's not able to detox and it's not able to get rid of all the toxins, whether it's be fecally or, you know, through feces or through urine, then we're going to try and get rid of it through the skin, okay? So we're now going to talk about treatment, and this is how we then help our patients, yeah? So the very first thing is, you know, it becomes a lifelong gluten-free diet. So it's not that, you know, after 3 to 6 months when the gut's feeling great and the villi are now restored, can they go back onto gluten? No, they can't, because they're still going to have that autoimmune response. So it has to be lifelong gluten-free diet. So this means all of the grains that are listed there. So your wheat, your barley, your triticale, your bulgur wheat, the couscous, the semolina, the durum. Now, we talked about oats. Here in Australia, oats can be manufactured in the same processing plants as the wheat, the rye, the barley. Here in Australia, we don't have to label where our oats are processed. So this is why it's sometimes better to buy organic whole oats or oats where you know where they've come from, because they're not labeled. And oats, depending on where they've been processed, because of cross-contamination, as you can see down the bottom there, and we'll discuss that later, because of cross-contamination, could still contain some of those other grains. Your breads, your cakes, your batters, you know, the batters that go on your fish or your fried foods, your bread crumbs that go onto foods, pastries, pastas, noodles, biscuits. The list is endless. You'd need to certainly research it further to give your patients a very extensive list. I've not mentioned everything here, obviously. Sauces, so your soya sauce, it contains, because again, soya beans are processed in the same processing plants as your grains, because again, it is a grain, your soya sauce could contain gluten. Hence the reason why tamari is a better option, because it is gluten-free. Gravies, so any sort of, you know, pre-packaged gravies, your stock cubes, anything that has maltodextrin in it, you know, again, cross-contamination. Anything that has yeast extract in it, again, cross-contamination. Or your processed meats, because they all contain some sort of grain, whether it be wheat or rye or barley. So your sausages, your burgers, your pâtés. I know there's a lot of you out there going, no, don't take my pâté away. But yes, your pâtés and your deli meats. The other thing that people forget to talk about, though, is drinks. You know, malt. Anything that contains malt is a no-no. So your malted drinks, your malted milkshakes, your beer, your whiskies. Some vodkas are processed in the same distilleries as the whiskey. So therefore, it can go into the same distilling vat. So you need to be aware again as to the spirits that your patients are drinking. Barley water, we've all seen, I'm sure we've all seen on the supermarket shelves, you know, some of those cordials where it says, you know, lemon barley cordial. Again, it contains barley. Now, barley's great if you've got a UTI, barley water, but it's not great if you've got celiacs. a lot of your plant milks, those nut milks, your cow's milks, the reason you need to avoid them as well is because of where they're manufactured, okay, the soya milks, etc. Now, the cow's milk you need to avoid because it's an inflammatory marker. So we need to consider, putting them on an anti-inflammatory diet, giving them some anti-inflammatory foods, your turmerics, etc., your chamomiles, things that are going to be gentle on the gut, maybe some slippery elm, maybe so that it coats the gut. I wouldn't be giving them psyllium husks because they're inflamed. I'd be more inclined to give them slippery elm because it's going to be gentler and more demulcent on the gut. Your FODMAP diet, you can research that yourself. Again, it takes away a lot of things that break down through sugars. It's important to teach your patients how to read labels. And it's important that they know that even in their home environment, there could be cross-contamination. So just because mum has celiacs and the daughter has celiacs doesn't mean that dad has. So dad might put some non-gluten-free bread in the toaster, and even that can cause, depending on how chronic and how severe their celiac is, even that can cause issues. This is why in restaurants it's better to not have any fried foods, because again, you can't guarantee if something's, even the chips that you get in your restaurant, they can't guarantee that it doesn't have gluten in it because you don't know what else they've put in their fryer, okay? So it could be as bad as kitchen utensils. They may be flipping a burger patty, and then they might put an egg onto a gluten-free bacon and egg roll for you in the morning. It really is quite that severe. You might need to separate your condiments. So even spreading strawberry jam on your toast in the morning that's non-gluten, and then using the same strawberry jam and spreading that onto your gluten-free bread could contaminate. It can be really that severe, okay? So here you can see what you can eat. So your meats, your eggs, your quinoa, your milk, your vegetables, your legumes, nuts and seeds. Again, depending on where those nuts and seeds are manufactured though, okay, cheese, rice, etc. Be careful with your ready-made meals, your cereals, even your chocolate, depending on where it's manufactured, okay, oats, noodles. You can see there's pickles and chutneys, etc. I'm not going to go through it all because we're going to run out of time otherwise, and I don't want to lose connection. You must stop things like beer and barley and pancakes and all of those things that are made with those particular grains. So what can they eat? Brown rice, quinoa, amaranth, tapioca, sorghum, sago, your high complex carbohydrates, so your sweet potatoes, your corn, your pears, your greens, certainly most of your meats, unless they've been processed, your legumes and your pulses, your nuts and your seeds. And there are plenty of other flours out there, so they can still make breads if they like to make their own bread. So you've got your potato flour, your almond flour, there's rice flour, there's corn flour, there's besan flour, which is chickpea flour. Again, you need to be cautious though of where they are manufactured. All of these flours are good flours because they're non-gluten, but it depends on where they're manufactured. So you can see here the main issues: wheat, barley, malt, rye. Again, more of where, your cookies, your donuts, some of the cereals, crackers, flours, etc. Your chocolates, your sweets. Now you can see here where there are other sources, and we're going to talk about those as well in the next slide. But you can see there that it says drugs and over-the-counter medications, and even our nutritional supplements. Depending on what the binders are, they're what we call excipients. And it's the things that allow us to make a tablet solid. So the binding agents could be gluten. Okay, so you need to be aware of that. we need to consider that we might need to put them on some nutritional supplementation for a little while. So, you know, a multivitamin powder or liquid is going to be better than a capsule or a tablet, especially if we're checking that the binding preservatives and excipients that they've used are not gluten. They will need some pre and probiotics. You can look at that aloe, slippery elm as those gut demulcents. If you're going to give them aloe, then get them to try a little bit first, because aloe can, you know, again, it might be better if they put it in some water and have it watered down. And it's only like 10 mils. They're not drinking a lot of aloe. It's only a small amount. Slippery elm, your turmeric. If there's pain, there's a thing called PEA. I'll let you research that yourself. But it's one of our natural cannabinoids, which is in the body. And it's really good for a lot of chronic pain conditions. You need to consider that they might have to take these supplements for around 3 to 6 months, because that's how long it may take to heal the gut. You always need to give your patients a time frame, no matter what is happening. Depending on how severe the chronic inflammation is, they may even need intravenous nutritional supplementation if the damage is too much. And if the damage is too much and it can't be fixed even with a gluten-free diet, they may have to have those intravenous nutritional supplements on a regular basis. So a few little snack ideas. You've got your popcorn, your seaweed, you've got your fresh fruits, you've got, you know, it says oat granola there, but again, be careful of the oats. Okay, get them to make their own granola. That's always good. Kale chips, tortilla chips. There's many, many things that they can eat, like your edamame beans, you know, your roasted chickpeas. Those things are really good to eat because it gives them something that makes them feel a little bit normal. Yeah. Again, because it is such a common disorder, we need to emphasize that, you know, you are normal. All right. This is just your new norm. Non-food items, as we discussed, medications, supplements, nutritional supplements, some cosmetics. So, you know, those cosmetics, I've put a list there that you can click on, which will give you all the brand names of the cosmetics that have gluten in them. And there's a lot, I can assure you. Lipsticks, lip balms, shampoos, even some of the toothpastes that you use, they may be bound with some gluten products. Play-Doh, how many times have you seen little people in schools play with Play-Doh? I don't think they do it anymore, admittedly, but it's made with gluten. Some pet foods. Now, you know, imagine they're touching their, you know, dog or cat, and the pet foods that you're feeding that dog and cat have gluten products in them or wheat-based products in them. Even that, you know, you know, whether it be an infant, they could be, you know, getting licked by the dog, and then all of a sudden, you know, they have a flare up or be triggered. So pet foods need to be looked at as well. Even something as sacred as the communion wafer, which is given to Catholics as the body of Christ. That wafer can be, I know in some churches they now do gluten-free wafers, but there was one case I heard of in particular of a woman that kept getting triggered on a Sunday night and Monday morning, and they eventually found out it was the communion wafer that was triggering her. Now, Celiac Australia is a very good website for you to direct your patients to, but they work hand in hand with Woolworths now, and Woolworths have really gone to the forefront as to one of the main supermarkets that do have a wide variety of gluten-free products. And they actually celebrate gluten-free or celiacs week between March 13th and March 20th, where those that have celiacs can actually go in and get discounted gluten-free products. So I think that's quite a nice thing for the big supermarkets to do. So you can see there gluten-free makeup and cosmetics. Here are some labels of brands that are gluten-free that you can find. Again, this particular one, so this is from Real Food Distributors. This is the link that I found. Now, they are an Australian company, so you can give this website to your patients and they can order their own gluten-free products. Yeah, again, they need to, just because they're gluten-free and they're processed doesn't mean they're good, because you need to also get them to make sure that they're not too high in salt or too high in sugars. You know, they're more of a discretionary food or a treat food than anything else. Here are some of the advancements that are going ahead, you know, and one of the biggest forerunners at the moment is in the States. They're doing studies on what's called nanoparticles, and it's a bit like a desensitization. You know, if you look at a lot of the allergies that, you know, we discuss and we talk about, they often talk about desensitizing the patient. And these nanoparticles are introduced to first degree celiac that haven't yet been diagnosed with celiacs, where they start to give these really microscopic nanoparticles, where they introduce it into the bloodstream to see if it can have a desensitizing effect, where they can build up the antibodies so that the immune system doesn't recognize gluten as being foreign. Okay, but these are some of the different types of treatment processes and research studies that are now in place, and you can read these at your leisure and certainly do some more research on them at your leisure. Coeliac Australia, as I said before. The other thing I want to mention to you is, you would have seen that there's different spelling. This celiac with the OE is how the English and how we spell it here in Australia. When you see it without the O, that is how Americans spell it. So if you're going to direct your patients to some of the celiac websites without the O, just be aware that if they're going to be recipe websites in particular, the recipes are going to be in imperial measurements rather than in metric measurements. So they're going to be in ounces and pounds rather than grams and milliliters. So it's always better that if you're going to give your patient a website that they can go to that has good recipes on it, make sure it's Australian-based or English-based. Well, no, not even English, because they work in pounds as well. But make sure it's Australian-based because it's going to be metric measurements. References, that's it. Martin, all yours.
Thank you, Sal. Fantastic. Well done. And I think next time we're going to have to make these sessions a little bit later, because your internet only works after about 7:15. So look, everybody, once again, thank you so much for making it to the end. Well done for persevering despite the technical issues that we had at the beginning. Now, we are going to open it up for questions and chat in just a moment. If you are watching this on YouTube, we'll leave it there. But if you do have any questions, please do feel free to get in touch with Switch On Health, or you can just type your question into the comments box below and we'll get back to you. Learn more with Switch On Health.